Real Country 1430 AM and 107.3 FM WRDN. I'm Brian Winnikins, joining us right now is Pepin County Health Officer Heidi Stewart. We are going to talk a little bit about the COVID-19 situation, get an update on that. And Heidi, thank you for joining us. Well, first, I guess, give us an update on the numbers. We seem to be in a bit of a decline.
We do. A steady decline, plateau, whatever you want to call it. Every once in a while, we have a little bit of a peak. We are at 602 total cases, with 553 of those charted as recovered. Another slew to be coming off that active list tomorrow. We currently have 3 individuals hospitalized. That's a total of 23 total individuals out of that 600 batch. We were able, I know last week I reported that we were having some trouble with the death data and the reporting. And at one point we were up to 5, and they did take that away as they look at the death certificates and figure out what counties individuals are actually from. So we are at a total of 4 deaths, which I think is what I had reported last week, if I'm correct. I do have that chart that I showed last week, again, ready to show today. If you can go ahead and get me over to sharing. What I like about this chart is that it shows the testing that we're doing, and then it also shows the positive results. So what we have going on out in the community. So here, is that sharing now, Brian?
Yes, it is.
Yeah, so as you'll see there, I only did it since the beginning of November. We had our first testing site on the 15th, and then a while later we had another one. Actually, I'm looking at my testing sites. No, the first testing site wasn't on the 15th. It wasn't actually until the 8th of December. I'm sorry about that. Anyway, we saw a peak here where 60 individuals were tested on the 15th of November. We've had a few days since then where we've had high testing. And yeah, you'll see these numbers are actually a little shifted because DHS, this is based on DHS reporting, so it's a little bit behind. So if you move that data a little bit, if you move the dates a little bit to the right, it's actually a little bit more accurate. The peaks in the testing show some of our testing days where we had the testing sites. And then the corresponding positive rate is up. But for the most part, if we drew a trend line from even the beginning of, well, if we drew it from the beginning of this whole thing, we would see a large bell around September, October, November, and then you would see that we're plateauing down, plateauing and decreasing a little bit there. So the last 6 weeks is what we're looking at right here. Our average cases, for the most part, are less than 10. Our average daily cases are less than 10. Some days it's even less than that, with just the one big day of positives reported on the 15th, and then another day in the there are 2 more days in the mid 20s. Otherwise, everything is under 10. So I like looking at stuff like that. It's hopefully pretty representative of what's out in the community. I would encourage people to continue to get tested. Like I mentioned, the wing testing site will continue. That will be available next Tuesday, same location out at the Durand Highway Shop. The time frame is going to be a little bit less. It's going to be from 10 to 4 instead of 10 to 6. For the most part, there has been no waiting lines at those sites. If you show up right at 10, there might be a little bit of a backlog, but otherwise it's taking people less than 5 minutes to get through that testing site. The first time we had over 50, the last time we had around 40. That's available. It's easy to use. There is pre-registration available. So go ahead and check our Facebook page for that pre-registration link. And it's free. So you don't have to get a doctor's order. You don't have to spend any time talking to a clinician, which Advent Health reported to me today when we talked about testing and what some of the hurdles are. Some people are really looking for free access to testing. and some of them are looking for something where they don't have to communicate with a clinician, which the wing testing site is that option. Otherwise, Advent Health continues to be a great partner for us in testing. Turnaround time, it is the same day, if not within the same 2-hour, 3-hour, 4-hour time frame. It's a really quick turnaround, and that is for a PCR test. It's a rapid test, but it's a PCR test, which is those that are more reliable.
Talking with Heidi Stewart, Pepin County Health Officer today. Heidi, obviously the big story: vaccine, and that it's being delivered. It's here in Western Wisconsin. I know Mayo Eau Claire reported they were receiving vaccines. So when can we expect that to be here in Pepin County?
That was also part of the discussion with the hospital today. And Angela Jacobson, who you've had here on the radio a few times in the past, is the main contact there for that vaccine. She's the one that completed the application. She's the one that will be calling when they say that it's going to be delivered. We have not received notice of that vaccine actually coming out to Advent Health yet, which they're considered a spoke. So Monday, 10,000 doses went to 4 hubs. So there are 8 hubs throughout the state of Wisconsin. 10,000 doses went to 2 of the hubs. The following day, approximately 20,000 doses went to 4 of the hubs. And then today, the last 2 of the hubs are getting their allocation of close to 20,000. So the first allotment, which is the Pfizer vaccine, which requires the ultra cold, should be at all those hubs, and it is going to the spokes. Now, they're not telling us where those hubs are. So whether or not Mayo is the hub and that's why they have it, or they're a spoke and they got it from the hub, we don't know that yet. But Advent Health is one of those spokes. Once it gets to our hub, and once all the T's are crossed and the I's are dotted, that vaccine should be able to come to Advent Health, where they're going to start to work on vaccinating their healthcare providers there. Also in phase 1A, and we might have talked about it before, but also in phase 1A will be the emergency medical service providers, so EMTs. They're also in that. And Advent Health, if vaccine is available for all of their providers, they'll start to vaccinate then those other groups in phase 1A. Except they will not be vaccinating the skilled nursing facilities or the assisted living. So there is a federal long-term care pharmacy program that has been set up to take care of all of the long-term care facilities, all of the congregate settings. So for us here, we don't necessarily have long-term care, a nursing home per se. We do have the assisted living, and then we have several group homes where there's large groups of people living, some high risk. So those will be taken care of through that pharmacy program. And we did put a press release out yesterday. Some people may have a question, well, when is the health department going to get their vaccine? We certainly will not be getting vaccine anytime in the near future. We don't have the capability to handle the Pfizer vaccine with the ultra cold temperatures. We don't have the staffing to get 975 doses out quickly, which is part of the reason why the Pfizer vaccine is going to the hubs. That vaccine is shipped in big allotments, so close to 1,000. So the hubs are then dividing it up while they're storing it in their ultra cold storage facilities, and then they're sending it out. So that may be another reason why our smaller rural county hospital here has not gotten their allocation yet. If they're working on dividing that big allotment up into smaller chunks, we may be closer towards the end. So Angela and I both had a conversation we both agreed today that we just need to continue to send those emails to the state and say, where is Pepin County's allocation, so that we can get it here. We can get the process started, and we can start to develop some type of herd immunity, at least within our healthcare personnel.
So, and as we move on farther down the line, how will this, like if we want to have a community-wide program or something like that, and again, this might be in June or July, I mean, much farther down the road, but then how would that work? Is this going to be where that's going to be organized by Advent Health and we all have to go there, or how? I mean, or is that's something so far down the line you haven't even thought about that yet?
Well, we're thinking about it, and it's actually what we've prepared for. Mass vaccinations are something that we practice every single year when we do our influenza clinics at the schools. We have the supplies, we have the plans, we have, from the plans include notifying the school that the vaccine's available, getting the consent forms out, getting those people in, prioritizing the groups that come in. We have all of that ready, but right now we're continuing to be very overwhelmed with the contact tracing, the disease investigation, making sure that there's adequate testing available, that it just makes sense to send the vaccine to the healthcare providers to vaccinate their own people. The role for public health may be later in the game when it gets to be the general public and the vaccine is available wide scale, when Moderna's vaccine is up and ready to go, or Johnson and Johnson's vaccine is up and ready to go. That will more likely be the place where we will start to call our volunteers in that we have in our volunteer registry, and start to do some of those mass clinic sites. So it's a very common question, and I don't know the answer yet. That was really me kind of circling around, but not really answering your question, because the state, we're talking about this daily. We're asking questions daily, and we're just waiting for more information.
All right. Well, Heidi, again, I guess it's just one of those hurry up and wait things that we'll have to do with that. But we, as always, appreciate you joining us today.
Thanks. And I will most likely not be available next Wednesday. So I do want to wish everybody a happy holiday season. Be safe. If we ever do get snow and you are out and about, make sure you're traveling safely. Obviously, during this time with COVID, when we don't have that vaccine in people's arms so that we have the immunity, we need to continue to be doing things such as socially distancing, staying home as much as possible, which I believe that we did a fairly good job in Pepin County with that and the surrounding areas, as we did not see a surge in cases following Thanksgiving. So while it was not fun, I think that people did do what they needed to do for the most part. With the social distancing, finding different ways to do things. Maybe you prepare a meal and you deliver it, and then you figure out a way to virtually share that meal, or you figure out virtually how to do board games or try different things. It's different. It's not what we're used to, but it's what we need to do to get through this 2020, and then let's get into 2021.
And hopefully things will slowly get back to normal.
Yeah, where we can take a deep breath.
Exactly. Heidi Stewart with the Pepin County Health Department. You're listening to WRDN.